it. Dr. Raghavan, there was a question earlier in regards to pregnancy before and after. So does this product help conceive? And if it does, let's say pregnant women, right? Would they be advisable to take the product? And would it benefit them in any way by taking it?
Interesting testimonial we had in London. This lady is in UK. I have met her last time I was there. She had a child 8 years ago. After that, she could not conceive. And then she took this stupid Pfizer shot, whatever, 2 or 3 boosters, and she couldn't conceive. Then she had all kinds of problems. So she started taking METADICHOL. 3 months, all the side problem disappeared. And 3 months later, she, in April, delivered for the first time after 9 years, a healthy boy. So there is your proof. And we have seen many people improve. It will definitely improve, because the whole, I didn't discuss it, but a lot of this thing has to do with the vitamin D receptor and its actions. There is a gene called SF, a nuclear receptor called SF, it was in the list, I forgot, which is increased 27-fold at 1 picogram. And this nuclear receptor is responsible for reproduction. So the proof is there.
Okay.
So everybody should take it. There is 0 side effect. You think you're healthy, you take this product and suddenly find out that you feel different. You know you are not healthy to begin with.
Okay. All right. Mr. Dennis, I'm going to unmute you. Please proceed with your question. Thank you.
Yeah, hi. Good evening, doctor. My question is, does this help with ADHD and type 2, I think, diabetic is what I like to ask you.
Yeah, type 2, we have done many cases. I showed you the type 2.
And ADHD as well?
What? ADHD, yes. We have had a lot of children who have responded within a week to 10 days of changes in behavior.
Okay. Now, for something that it has helped, do you need to continue using the product?
Yeah, you see, this product is not a drug. So this is not just about ADHD. It's not just about diabetes. It's, let's say tomorrow Ebola comes, which these guys are capable of doing. Your body is ready to fight it. It's about prevention. It's about cure.
Okay.
It's not about curing. It's about prevention.
Okay.
You need to keep your body's immunity at a high level, so that any new, because the biology of the parasites and the bacteria is constantly evolving. Bacteria, for example, can mutate within half an hour to a different form. Okay, so that is why all the antibiotics have become are now bacteria resistant to it. So they're very smart. So, but if your immune system is ready, it can handle it. So it's food. See, this is the way you eat food every day. So why not the food that is missing in the food you eat?
Understand. Thank you.
Thank you, Mr. Dennis. Mr. Joe, I'm going to unmute you now. Please proceed with your question in regards to the METADICHOL.
Yeah, it's a miss anyway. Okay. It's a miss.
Sorry.
It's okay. No worries. Thank you, Dr. Raghu. I have a very simple question. Okay. Now, with everything that is going on in the world, you can see that there are these lefties, the righties, and all those things happening in Europe and everything. And we are told that this this METADICHOL is from Switzerland, and it's using Switzerland's water. So how sure are we that this is safe?
This is what?
Safe water, safe.
Yeah, because you can go to Switzerland, we can give you the water quality, test it. This is why we chose Switzerland. Quality.
Yeah, but what I'm saying is, won't there be any problem in the near future with so many, all these things, coming on and saying that they're, poisoning the water and the weather and stuff like that?
Yeah, see, for example, I showed you the bacteria. Let's say these crooks put bacteria in the water, which they're capable of doing, nano will take care of it.
Okay, thank you.
All right, thank you, Joe. George Gonzalez, my apologies if I mispronounce your name. You may proceed to unmute and ask your question.
Hello, everyone. Dr. Raghu, thank you very, very much. This is my husband, Dr. Gonzalez, but I wanted to tell you because every member of our family and staff uses METADICHOL. And it's my husband who's been working with Dr. Raghu on policosanols. In 2021, I was going to come with my daughter Isa to Colombia to have stem cell done on my knees because I had meniscus problems from riding. I accompany her and she's a world-class endurance rider. And I'm 69 years old. And Dr. Raghu said, Mariana, give me 4 months of your life. I said, for what? And he said, I want you to spray. And at that point, I was using braces to be able to walk, those plastic braces on my knee. Right, he said, in 4 months, you'll be walking fine. In 4 months, I was walking fine. I went to the doctor in the States and he told me, you have a problem with the tendon because you haven't used it for so long. So by the time you get to 4 miles a day, you'll be fine. Well, now I'm fine. Never had surgery, never had stem cells inserted into my body. I used to go every single year to Mass General Hospital to have cancerous cells removed from my face. I wear no makeup, I never have, because I was afraid because of the cancerous cells. After, I would say 3 months, disappeared. When I saw, because of COVID, we didn't fly up that time to Mass General, to Boston, and it was with Dr. Ernesto Gonzalez, the head of dermatology at the hospital. The cancerous cells from my face have disappeared. My complexion has nothing, maybe a little color left from many, many, many years of that. And I'm a horse breeder for 51 years, Arabian horses. I have a mare that's accompanied me for 17 years. And I had ridden her for approximately 30,000 kilometers. That's the life we have shared. One day, my vet, who was head of the National University here, calls me and said, I have very bad news. Your mare has developed a mass in her eye. She's going to lose her eye and you will never be able to ride her again. And my daughter was here in Colombia at the time. And I said, Isa, I believe in Dr. Raghu so much. Do you have any spray with you? She uses it. And she said, I do, Mom. I have half a bottle. And I said, start spraying Gitana. Dr. Raghu has all the medical work from IVET, who was head of the National University. The tumor disappeared. The mare is seeing perfectly. She's in perfect health. And I just want to thank him and for the friendship we've developed through all this and for his miraculous cures for everything. I mean, they're endless what they have done for us. My husband, when he saw what I did with my mare, he decided to spray his eye, his right eye, where he had a pterygium, which was driving him insane because it itches, it's red, it gets in the field of vision. That's gone. Dr. Raghu has all the proof from Mass General Hospital and such. Member of my staff asked if he could have some METADICHOL. He has no pterygiums and it was in both eyes. So what can we say? We're forever grateful that this has come about. I want to introduce my husband.
I am very, very grateful with Dr. Raghavan. And thank you very much. My wife talked to me because I do not speak the English very well, but he explained me everything, you know, is why these policosanols in the way that Dr. Ragaman have been doing stabilizing the policosanols, and that we did it in Polycane2 is making miracles, is doing miracles. It's incredible. Thank you, Dr. Raghavan, for your friendship.
I just want to mention passing. He's the gentleman who developed the sugar, which completed my story of 5,600 years, how the Indian temple actually made jaggery in those days. And he has found that. And we found that the policosanol are what is in the jaggery that makes it happen.
Thank you. Thank you. I'm going to take one last question from Jonathan, and I'm going to focus back on the chat. Jonathan, please proceed with your question, sir.
Okay, Doctor, thank you for your good sharing. My question is, your product can help a patient to recover up to 100% or up to 80%, 70% with reference to diabetes, stroke, Parkinson, cancer.
Yeah, it will be 100%. The only thing I cannot tell you is how long it will take. It depends on how long you had the disease in the first place, you see. So
Can
that
go up to 100%.
Yeah, it will happen. There is no, see, you can easily go to 90%, go to 95%, but the transition from 95 to 100 is a much slower process.
Okay.
So it'll let you be functional. There may be, slower growth. For example, we have seen in patients, they come to 160 blood sugar from 400, but that 160 to 100 takes much longer because the body doesn't see that as a threat. And the reason I think it is it wants to fix the underlying cause of the problem. It's like this, from Kuala Lumpur to Singapore, there are many ways to go. One is shorter, one is longer. So the path it takes is different for different people. This is exactly what's happening. We see people. Some people recover like instant. I mean, I had a guy with arthritis for 2-3 years. It was gone in the first week. First week, it was gone.
Okay, okay.
Thank you. Dr. Raghavan, does METADICHOL interact with medication, especially anticoagulants or anti-platelet drugs?
What? No, say it again.
Okay, does METADICHOL interact with medications, especially anticoagulants, as well as anti-platelets drugs?
No, because you see, this is present in every food you eat. For example, policosanol is present in pasta, it's present in grapes you eat, wheat you consume. So it's not affecting there. It's not, this is much lower than that. So there's no chance.
Okay, and how can METADICHOL help with someone breathing issues as the lungs are congested with nicotine? I'm assuming this is a smoker.
Yeah, we had people recently, a doctor friend of mine, this is how it works in COVID patients, by the way, because they have less oxygen. So the minute they take it, the oxygen shoots up. This lady had suddenly her oxygen level dropped to 75, her blood sugar shot, BP shot up to 195 by 110. 5 sprays, within 15 minutes later, her oxygen was back at 95 and her hypertension was at 135. So there is something called HIF1 alpha. You can look at one of the genes that it works on. So we have seen asthma patients recover completely. Even with smokers, it helps. I have quite a few people who are smokers who gave up. And one of the things it really does, which I recently got from a few other people, was it cuts your appetite for alcohol. And also people who use drugs like cocaine and all that, within a few days, you see them give it up, literally. I had a drug dealer tell me that in 4 days, all his side effects of 20 years of drug use went away. So he was based in Toronto, Canada, but he refuses to write to me exactly the data. But he did tell me in a text message that this is what happened.
All right.
So
Dr. Raghavan is, sorry.
You'll also lose, it curbs sugar and chocolate use as well. So I gave it to a couple of police officers in India, some people I know high up in the police. Next week they called me and said, Raghu, what did you give me? I said, what happened? I don't feel like touching the whiskey anymore. Their wives called me and said, wow, you did such a great thing. Now we don't have to spend money on whiskey.
That's
I can
wonderful.
I cannot touch wine. I cannot, even if I want to, I cannot. It just says, see, what happens is this. Most people react because they smell something, okay? And the signal has to come because of the smell. They eat the food. They're walking somewhere, a food market, they eat. But this stuff, when you start using metadicol, the brain is going to tell you, go eat. Not the nose. So I could go walk through a food market with all the exotic smells. There is no appetite for me. The brain hasn't told me yet. It's, by the way, it's called leptin. It's one of the hormones it works on. It controls leptin. So I can go through the market with fantastic smells. No interest in food. But when it's time to eat, it'll say, go eat. It'll also tell you over time if you eat certain foods that affect you, it will throw it out of the system. And if you can link it, you will know what food to eat and what food not to eat. It happens over time. It doesn't happen instantly. So.
Got it. Doctor, is there any study done on glaucoma yet?
Oh, yeah, we had a lot of people, glaucoma levels come normal. Yeah, glaucoma, macular degeneration, even people with cataracts. They went to, this lady had cataract. I think it's one of the testimonials we have. And the doctor said, come back next month. So she used nano. Next month she went. He says, what did you come for? She went to a different doctor. What did you come for? I came for an operation. What operation? You don't need an operation.
Okay. Doctor, does this product, METADICHOL, help with Down syndrome?
I haven't specifically know of a case, but it should. The Down syndrome has to do with your immune system. So.
Yeah. Okay. Just give me one moment. Okay, I'm going to go back to video. Mr. David Lau, you may ask your questions. You may unmute yourself, sir.
Thank you.
Okay.
I've actually you have actually asked the question. I actually did post a question in the chat group. So anyway,
the glaucoma one.
Yeah, that's right. And for further to doctor's response, how is it how does it work as far as for glaucoma is concerned?
No, glaucoma has to do with vitamin A. You see, whatever binds to vitamin D also binds to vitamin A. Vitamin A, sorry, it's called RAR, nuclear receptors in the body, which controls vitamin A. So that's how it works in the eyes.
I see.
It also
Okay,
reduces
so
blood glucose. Oh.
Sorry?
It also reduces blood glucose. So you may know that. So the same thing happens in the eye. Glaucoma is because sugar level is slightly higher in the eye.
Yeah, that's one issue. The other issue is due to the pressure in the eye. So my problem is actually due to the pressure.
Pressure, that will also come down. Yeah, you can directly spray in the eye. We have had a lot of cases of people becoming normal within 1 to 2 weeks.
So that can be applied directly onto the eye?
Absolutely.
Okay.
It'll sting a little bit because our product contains a little bit of citric acid. We have to add because a lot of countries demand you add a preservative. So we chose citric acid. So it'll sting for about 10-15 seconds, but it's very safe. I have here, I can show you. See?
Right.
It just stings for a few seconds.
Right. So it will also bring down the
amount anytime. It's absolutely safe.
Wonderful.
Okay.
Thank you.
All right, wonderful. Thank you so much for the question, Mr. David. I'm going to unmute you, Mr. Vijay. Please proceed with your question.
Hi, Dr. Blessed day to you.
Yeah.
We have listening to your wonderful explanations. We are getting a lot of knowledge today. I have one question to ask.
Yeah.
Okay, could you elaborate more about the gulogene and the function of a gulogene, is it correct? I would say if gulogene, the excess of glucose in our body, gulogene will convert the glucose into vitamin C. Is it so?
Yeah, so this is true. See, what happened is 40 million years ago, this average cell had a gulo gene. Gulo is the last step in converting vitamin C. There are 4 steps. From glucose, it goes to vitamin C. The last step is the use of gulo gene to become vitamin C. That gene has become defective in humans 40 million years ago. But evolution-wise, what it is that the gulo gene mutated in humans. So we had a lot more free radicals now because of less vitamin C. This allowed for the evolution of man, actually, in a way. So the gulo gene dysfunction led to the evolution of man, at least in the cell-wise. Now, animals can convert gulo to, they have gulo, so they convert all the sugar to vitamin C. Okay. What we found is my product in mouse, which we have published the work, is an increases gulo in mouse. But unfortunately, we don't have that gulo in human beings. The gene exists in human beings, but it's defective. So we haven't found anything to increase it. So what the body has a substitute is it recycles vitamin C. So let's say you take 1,000 grams of vitamin C, your body will absorb only probably a few milligrams. The rest is thrown out as oxidized vitamin C. This product will take that oxidized vitamin C into each cell and recycle it. So this is how our product works. So gulo gene is great if we could get it back, but I don't think it's going to be possible. So